Now let us move on to constipation and fecal impaction. Constipation is a general term for bowel movements that are usually small, hard, dry, difficult to pass, or infrequent. A serious complication of constipation is fecal impaction. A fecal impaction is a mass of putty-like or hardened feces that collects in the rectum and prevents the passage of normal stools. What are some of the causes of constipation? They are inadequate fluid intake, inadequate bulk in the diet, sedentary lifestyle, poor bowel habits such as ignoring the urge to defecate, immobilization due to illness or injury, medications that slow intestinal motility, intestinal problems that obstruct the passage of stool, overuse of laxatives, and aging, which slows peristalsis and for some people decreases activity levels. Signs and symptoms of constipation include straining at stool, abdominal bloating, abdominal discomfort, and a feeling of rectal fullness. The client who is developing a fecal impaction may experience diarrhea because stool liquefies in order to pass around the hard impaction. It is important to check the client's stools to determine if they are hard and dry. Examine the client's abdomen. Does it appear distended? Listen for bowel sounds. If you suspect fecal impaction, perform a digital examination of the rectum and feel for the presence of a hard mass. Inspect the rectal area for redness, fissures, or hemorrhoids from straining at stool. The primary nursing diagnoses for clients who have constipation are constipation related to a change in bowel habits, pain related to difficulty in passing stools, risk for fluid volume deficit related to inadequate fluid intake, and anxiety related to difficulty in passing stools and fear of fecal impaction. Medications that are used to treat constipation include stool softeners, such as Docusate sodium, that's Colace. Also used are bulk-producing laxatives that contain psyllium, such as Metamucil, and stimulant laxatives like Bisocodyl, that's Dulcolax. A severely constipated client might require the insertion of rectal suppositories or the administration of an enema. An impacted stool might have to be removed manually. It is important to instruct clients about how to prevent constipation. Suggest that they record their daily intake and output of foods and fluids. Drink 8 glasses or more of water and fruit juices daily. Include more high-fiber foods in their diet, such as whole grain cereals, raw fruits and vegetables, and products containing bran. Schedule some time to exercise every day. Walking is an excellent exercise. If possible, respond right away to the urge to defecate and allow enough time to have a bowel movement. Try to establish a routine time each day for bowel elimination. For many people, the best time is after meals. Avoid straining at stool because straining can cause serious heart problems as well as hemorrhoids. Avoid the overuse of laxatives, suppositories, and enemas. And finally, if constipation persists, they should consult with their primary care provider.